Let's talk about the bursae of the knee. So the bursae are small fluid-filled sacs, and they're located in various areas of the body, including the knee. Their primary function is to reduce friction between tissues such as between bones, tendons, muscle and skin, ensuring smooth movement. Now the knee joint contains several bursae which play an essential role in protecting it during activities that involve repetitive movements or pressure. So let's look at the main bursae of the knee. So the knee has multiple bursae, but the most commonly discussed are the prepatellar, infrapatellar, suprapatellar, and the pons anserinus bursae. So let's start by looking at the prepatellar bursae. Now this is positioned between the skin and the front of the patella. Now the prepatellar bursae reduces friction between the skin and the patella, especially during activities where the knee is frequently bent or in contact with hard surfaces, for example, kneeling. Now, common issues. Sometimes you can get a prepatellar bursitis, also known as housemaid's knee, and this occurs when the bursae becomes inflamed, typically due to prolonged kneeling or direct trauma. Now let's look at the infrapatellar bursae. There are two of these. So there is the superficial one, which is located between the skin and the patellar tendon, just below the kneecap. And then we have a deep infrapatellar bursae, which is positioned between the patellar tendon and the tibia. Now, these bursae reduce frictions between the patellar tendon and the surrounding structures during knee movement, especially in activities involving jumping and running. Now, inflammation of these bursae can result in an infrapatellar bursitis, and these are often caused by repetitive stress or overuse, particularly in sports like basketball or volleyball. And then we also have the suprapatellar bursae, which is located above the patella, between the femur and the quadricep tendon. Now, this bursae allows smooth movement of the quad tendon over the femur during knee flexion and extension. Now, common issues related to this bursae is inflammation or injury to it, and this can occur due to repetitive motion, trauma, or infection. Then we have the pons anserinus bursae, and this is positioned on the inner part of the knee between the tibia and the tendons of the sartorius, gracilis, and semitendinosus muscles, and they're collectively known as the pons anserinus group. Now, this bursa helps reduce friction between the tibia and the pons anserinus tendons, particularly during activities involving knee flexion. Now, we can see common issues in this bursae due to overuse injuries, and we can see it especially in runners, and it can also affect individuals with osteoarthritis. Now, what are the functions of knee bursae? So, they reduce friction between tissues, helping ensure smooth movements during flexion and extension of the knee. They also provide a cushioning effect, especially in areas subjected to high pressure, such as during kneeling or activities that involve repetitive bending.